My name's Andy Cook and I run an organisation called the Centre for Social Justice. The job we've been doing for many years is analysing the root causes of poverty and the big social issues and disparities in the UK. We then offer solutions that are based on what's working to anyone and everyone that would listen. This mission sees us gladly spend more time outside of Westminster in our regional offices than it does in it, which, according to my own mother, who lives across the border in the People's Republic of Yorkshire, is a total no-brainer. We are proud to be here today with our great friend, the Secretary of State for Health, because over many years, he's not only demonstrated a desire and an ability to listen, but the political will to do something about the things he learns. We spent the morning with Sajid here in the fantastic Grange Community Centre, and we heard from small charities, local leaders, about the work they're doing in changing some of the most vulnerable lives. Sadly, we heard how the work that ends up in your inbox, Saj, often starts in a more solvable form, whether that be in poor housing, which came up a lot, broken relationships, early addictions, or particularly lost jobs. And having had 18 months where these things have had petrol poured on them, Sajid's inbox is tangibly bigger than ever. But there's hope. There's always hope. And this hope is found in places like where we are today and the people we met around the table today. The little platoons of small charities, of businesses, of local initiatives that toil daily to support lives, to demonstrate love, to build up families, form a steel ring around people. They know how to treat people as potential to be developed and not problems to be solved. And they know what actually works in changing lives. This is why we're thrilled to hear today about Sajid's creation of the Office for Health Improvement and Disparities, as he moves the focus onto the root causes of issues, rather than just administering sticking plasters. This feels like a once-in-a-generation opportunity to establish a culture that says the stuff that we do in here, from education to parenting to employment, is the best way that we can stop people going down the road to the local A&E. And so on that note, I'll be quiet, because like you, I suspect many of you want to hear rather less from me and rather more from the Secretary of State about it. Sajid.
Thank you. I'm so grateful to the Centre for Social Justice and the Grange for hosting us all here today. I know that you're doing phenomenal things here at the Grange, and I will go and see that garden before I leave. You've been working non-stop for the last 18 months especially, getting out thousands of food parcels and Meals on Wheels to some of the most vulnerable people in your local community. It truly is a remarkable achievement. I'm happy to be here, and I'm proud too. I'm proud to get the chance to finish the job as the Secretary of State for Health and Social Care. Now, I have faced some challenges in my time in government. The crisis of rough sleeping, the tragedy of Grenfell, the injustice of Windrush. But becoming responsible for health and care in a pandemic has been uniquely challenging. I've been in this job for 3 months, but I can tell you it feels much longer. I had to face some tough decisions from the start. The first was, should we remove the restrictions that we know that have saved thousands of lives? I knew that we had to. In hindsight, that choice looks inevitable. I can assure you, though, that it wasn't. A lot of people were telling me not to go forward. They said, Saj, don't you think that we should stay locked down for longer? But I knew that we mustn't. I couldn't simply be the Minister for COVID, because we had to turn and face other challenges too. Challenges like the backlog. More than 5.5 million people on a waiting list for elective treatment. That is a record high. I arrived preparing for the worst, but I admit that even I was a bit shocked when my officials told me that the waiting list could rise to 13 million. I'm so impressed by what NHS colleagues are doing, including here in Blackpool and right across the country, to get treatment to those who need it most. I saw some of that phenomenal work in action just this morning when I went to the Blackpool Teaching Hospital. It's these kinds of incredible efforts that have helped us to catch up on cancer referrals, on diagnosis and treatment. But the latest data suggests that through the pandemic, there have been some 300,000 fewer urgent cancer referrals than were expected. And this could mean that there are some 20,000 missing cancer diagnoses. We also have nearly 250,000 people waiting for heart-related surgery. That's up 40%. I think we can all understand why the backlog has grown. We've had to meet the greatest public health challenge that this country has seen in living memory. And I know when I speak to my fellow health ministers, like I did just last week at the G20 meeting, those from France, Germany, Italy, and elsewhere, that we're all in the same boat. But doing nothing would be inexcusable. It cannot be business as usual. The responsible thing to do is to act now. So even while we faced the immediate threat of the pandemic, I was determined to secure the funding that we needed for the long term. The majority of those funds from this new levy, the Health and Social Care Levy, will initially go into the health service. It's an investment in the biggest catch-up plan in the history of the NHS. We're going to do some 9 million more checks and more scans and more treatments. We're going to set up surgical hubs so routine operations like hip replacements or cataract surgery never stop. We're investing in the next generation of scanners and screening equipment so that we're even quicker at finding diseases like cancer. And we're ending the lottery on how people will pay for social care, something that successive governments have ducked. It shows that we're serious about tackling the challenges that we all face and serious about our responsibilities to the NHS and social care. But the backlog is elective care. The backlog in elective care is only one part of the story. COVID-19 has, of course, had many hidden costs. We've seen that Black and Asian British people were more likely to die from COVID-19 than white British people. We've seen that our weight could determine whether we are hospitalized by COVID-19. We've seen that our mental well-being and our mental health can be so fragile when the scaffolding of our daily lives is taken away. And we've seen horrific incidences of domestic violence and child sexual abuse. So even as we move forward and we recover, it would be a mistake to pretend like none of this ever happened. Because the truth is that we're actually facing, I would say, two backlogs. The first is the waiting list, but the second is a social backlog in mental health and public health. It's much harder to quantify and it's less evenly spread. Passing the peak of the pandemic has been a bit like a receding tide, revealing the underlying health of our nation. It's revealed some fractures within, and in many cases, the pandemic has deepened those fractures. COVID-19 admission rates for the most deprived parts of England were 2.9 times higher than the least deprived. And the mortality rate was some 2.4 times higher. Despite making up less than 14% of the population, Black, Asian, and minority ethnic groups made up more than a third of critical care admissions for COVID. 95% of white British people over 50 have accepted the offer of 2 doses of the COVID-19 jab, while only 67% of Black Caribbean people have accepted that same offer. And when you look at Black Caribbean people over the age of 18, that number goes down even further to a little over half. These are symptoms of a different disease, the disease of disparity. And as we recover, we face a choice. Do we create a more level playing field in our society? Or do we simply return to what was there before? It's this government's mission to unite, to level up across the whole of the UK, and to build back better and to build back fairer. So our recovery from COVID-19, it can't be limited to supporting the economy. After all, we can only level up economically if we level up in terms of health too. That means returning to the noble idea on which the National Health Service was founded, that it meets the needs of everyone, and taking that to the next logical step, ensuring that everyone is given the same opportunity to live healthy and happy lives. And that's what leveling up in health means to me. Now, as we get to work on that mission, I can't help reflecting on my own past. I was born some 50 miles away in Rochdale. I grew up in Bristol, family of 7 living in a 2-bedroom flat above the shop. My first interactions with the NHS were when I'd go and translate for my mum at the GP surgery. Now I'm the one whose responsibility it is to make sure that the system is working for everyone, not just my mum. Now, if you think my mum was proud when I got this job, you'd be right. Like many Asian mothers, she wanted me to be a doctor and my brothers to be a doctor. None of us did. But she did say, when I got this job, she said, I'm really happy, I'm proud of you, because you didn't quite make it to doctor, but at least you're working in healthcare. So now I've got ahead in life because of family, because of hard work, and because of public services. I'm so lucky to have had that strong family foundation. So many people don't. I was very lucky. But I have seen real deprivation. And I know what it's like to feel that if you're on the outside looking in. I know some people in Blackpool feel like that today. We've got eight of the 10 most deprived neighborhoods in England right here. 8 of the 10 most deprived neighborhoods. 40% of the neighborhoods are classed as highly deprived. While life expectancy across the UK has been rising, here in Blackpool, it's been declining. It's now the lowest in England. It's 74 years for men and 79 for women. Now compare that to somewhere like East Dorset, where the figures are 83 and 86 respectively. When you do that, the disparity is very clear. Blackpool was one of the places that the Chief Medical Officer, Chris Whitty, that he came to last year when he looked at the health of people living in coastal communities across the UK for his annual report. I share his belief that it is entirely possible to raise the health outcomes of the least healthy closer to the outcomes of the healthiest. That's precisely what leveling up in health should achieve. So the story I want to tell here in Blackpool is not the one you might be expecting, because Blackpool has actually bucked the trend in many other ways when it comes to COVID-19. Despite having the lowest life expectancy in England, deaths from COVID were actually lower than in surrounding areas. Testing rates were higher than the national average. Despite the deprivation, we saw vaccination rates as high as anywhere else in England and some of the highest vaccine take-up rates nationally. All of this has been achieved because every part of government and society has joined up to make that difference. Now we can see here at the Grange today, where you're doing that with your, I think when I came in, I saw the walk-in vaccination center here, and people don't need an appointment, literally, they just walk in, pop in and get their vaccination. So for me, whether it's Blackpool, it's Bristol, it's Rochdale, it's Ruslip, the real message of this pandemic is that health interventions, they can work. We really can make a difference when we work together and we are all focused on our goals. Realizing our mission to level up in health means tackling our social backlog in mental health and public health with the same spirit and the sense of urgency with which we all tackle the pandemic. Nowhere is this mission more urgent than when it comes to our mental health and well-being. This morning's mental health roundtable, for me, which we had in this room a couple of hours ago, it was so valuable. I heard how, just one example about the hugely important role that's played by third sector organizations in helping with mental health challenges and mental health well-being. We also talked about the experiences of young people in this pandemic. Back at the hospital, I heard how the number of young people waiting for urgent treatment for eating disorders has more than tripled during the pandemic, while the number waiting for routine treatment has more than quadrupled. And too many people have experienced loneliness and isolation over the past 18 months. A lot is said of young people nowadays. People say that too often. But let's just think about that for a moment. They've overwhelmingly stuck to the rules. They've kept their distance. They've stopped seeing their friends, all so that lives could be saved. That's a remarkable thing. And I think it's not fully appreciated in some quarters. We owe young people an enormous debt of gratitude. And loneliness and isolation are challenges faced by people of all ages. 3.7 million adults reported feeling either often or always lonely. That's up by more than 1 million since the start of the pandemic. And for older people, for whom these experiences are nothing new, the pandemic has been especially difficult. People living in care homes, for example, have found it hard when they've been unable to hug, to hold hands, and sometimes even just see the people that they love. Social care staff have taken on difficult burdens of comfort and care. It's been such a relief to expand the number of named visitors so that care homes and help from families that can, all these people, all these workers and the families, they can all come together once again. Together, NHS and social care staff have been outstanding. And on meeting so many colleagues this morning, I'm mindful of the debt that we owe them all. They've been under extraordinary pressure. Some of them have had to care for 2, 3, or even 4 times as many patients as normal times. People kept coming in, night after night, struggling to breathe. Too many of them never came out again. I know it's taken an enormous toll, and I'm determined to look after the people that looked after us. The People Recovery Task Force is helping us to make interventions supporting staff. 40 mental health and wellbeing hubs are being set up in every region of England. They're working quickly to make assessments and to reach out to people who need help, including those working in social care, and we've backed them with some £37 million of funds this year. Colleagues facing mental health challenges like PTSD they deserve the support and the specialist support. And while for others, it might just be that they need more time off from work, they need a break. Because whether it's the NHS or across the country, it's vital that we are getting the right kinds of support to people. And I want to bolster those efforts in mental health right across the board. It's an indispensable part of living up in health and the key to a safer, fairer, and more supportive society. We're ending historic injustices by updating the Mental Health Act, ensuring people in acute mental distress are still met with the compassion and the choice that they deserve. And at the same time, we're looking at those resources that can help everyone. We know that 1 in 4 people living in deprived areas has a common mental health disorder. So we need to look at everything that's holding people back from living their very best lives. Our long-term plan commits us to an extra £2.3 billion a year to transforming mental health services by 2023, expanding them to reach families, to reach communities, workplaces, and schools. And we're launching a brilliant new resources like Every Mind Matters. I value mental health as much as I value physical health. I believe in the parity of esteem, because when you're healthier, you're happier. And when you're happier, you're healthier. It's my job to ensure that virtuous circle is right at the heart of health policy. We know that mental health has such a vital part to play in public health and healthy behaviors that we all want to see. Yet through the pandemic, we've seen alcohol-related deaths go up. We've seen an increase in young smokers that hasn't been seen, that kind of increase, for over a decade. And we've seen less physical activity across the country. For a lot of people, COVID-19 was a wake-up call to get fit and get healthy. But for others, it went the other way. In simple terms, it looks like healthy people were getting healthier, while unhealthy people were becoming unhealthier still. We need to reverse that trend, and we need to do it fast. COVID highlighted so starkly that our underlying health and lifestyle determine how resilient we are to new risks and to diseases. It didn't strike randomly or evenly. It hit much harder those people, places, communities whose underlying health was poorer, people who smoked, people who were overweight, or who had struggled with chronic conditions. The genius of universal healthcare is just that it's universal. So as Secretary of State, I'm determined that everyone gets access to the health and the care that they need, especially the kind of preventative action that will stop them from becoming ill in the first place. That's another way that we can ensure not just a healthier society, but a fairer society too. Even before the pandemic, it was clear that we needed a new approach to public health. We have an aging population and an increase in people with multiple health conditions. We're living longer, yet spending more of our life in poor health. And the poorer you are, the greater the proportion of your life is spent in ill health. Now, I know that here in Blackpool, for example, the demographics have been shifting for some time. Younger, more physically able people are leaving, while we're seeing more people with disabilities and long-term health problems come in. 1 in 10 working age people is deemed to be too sick to work. It shouldn't be this way, and it doesn't have to be this way. From the 1st of October, public health work in England will be led by a new body. We originally called it the Office for Health Promotion. But when I came into this job, my thoughts turned to what this office, with this weighty responsibility of shifting the dial on how we can improve health and how we can prevent disease, what it would really need to focus on this mission and to achieve its goals. So when it formally launches on the 1st of October, it will be called the Office for Health Improvement and Disparities, or OHID. It's not just a change in name, but it is a change it's a statement of intent. A driving mission to level up health and ensure everyone has a chance to live happy and healthy lives. It will sit in the heart of my department, and it will be jointly led by our new Deputy Chief Medical Officer, Janelle de Gruchy, and the Director General, Jonathan Maron. They'll be working closely with me and England's Chief Medical Officer, Chris Whitty. It's a dream team. It's the kind of people you'd want to have focused on this kind of vital mission. And there's 3 things that I'm going to be asking from this office that I want them to really focus on. And I want to just briefly share those with you now. First, I want them to look on how we prevent poor mental and physical health and help people live healthier lives. Because we know protection is better than the cure. That means being bold enough to tackle the biggest killers, especially the preventable ones, like tobacco, which continues to account for the biggest share of avoidable premature death, and it contributes to half the difference in life expectancy between the richest and poorest in society. Or obesity and poor diet, which together cause almost half of all years of life lost prematurely due to modifiable factors, and impacts deprived areas and Black communities far more than others. Or the harmful use of alcohol and drugs, which have killed more people in recent years than ever, and have harmed deprived communities in particular. Second, I want OHID to work with whoever it takes, from the NHS to industry, with life sciences to academia, to tackle health inequalities and access to health services, particularly the services that detect and act on health conditions as early as possible, like cancers and cardiovascular disease, for example, which are the leading causes of premature death. Together, they account for over 60% of years of life lost to premature death. The fact is that your chances of dying early from cardiovascular disease or cancer vary greatly depending on where you live in the country. So we need to do more to understand and tackle these inequalities. We need to make it easier for people to access screening services and diagnostics. And we need to make sure that everyone can get the support they need from primary care, which is often the first to spot the early signs of a problem. And third, I'll be asking OHID to work with partners right across government and beyond government and beyond, to act on the wider factors that contribute to people's health outcomes. Because we know that our health depends on so many factors: your job, your house, the type of housing you live in, your environment, the education that you had, and so much more. It has to be a truly cross-government approach. And we're also going to build on the brilliant work by Dame Andrea Leadsom through her early years review and ensure that every child gets the best possible start in life. So while I said at the start that we can't level up economically without leveling up in health, it's equally true that we can't tackle health disparities without tackling wider disparities too. Now, I would like to end this afternoon, with this reflection. When I look back at my own life, I often think about how I got here. Yes, I'm the product of a good family, and I have my parents to thank for that, of course. And I've worked hard along the way, but like most of the British public, I'm also the product of our public services. Whether it was going with my mum to that NHS waiting room, or going to the library because there wasn't enough space at home to study, or it was going to further education, it's our public services that have shaped me in the course of my life. I've now led 6 government departments, but being in charge of health and social care is a particular honor. For me, there's no greater example of what public service really means. We've experienced it in each of our lives, and never more so than in the last 18 months. I'm very pleased that I now get to see this job through. This is not simply a department that needs to be managed. It is a lifeline for so many people in our country. Yet even before COVID-19, too many people felt that the system wasn't working for them. We may have heard the pandemic described as the great leveler. It was anything but. It's made things harder. It's exacerbated our disparities. So tackling the backlog, addressing our social backlog in mental health and public health, facing up to the disparities in our country, these are the tasks that we must now take on, and we must succeed. And working together, we can be the great levelers, leveling up in health and bringing about a healthier, fairer, and more supportive society, just what we all deserve. Thank you all very much.
Fantastic. Thank you, Sajid. Brilliant just to hear about the social backlog, as you called it, that we knew was forming long before COVID, but then had petrol on it. And I know there's loads of questions certainly flying in on the online thing about that. But I'm going to pause and ask if anyone has a question in the audience first that they'd like to direct to Sajid first. Danny, if you can just wait for the old mic so that they can hear you online.
Thank you very much, Health Secretary Aubrey Allegretti from The Guardian newspaper. Congratulations, firstly, on being reinstated as Health Secretary. Yesterday was busy. This time last year, I know many people were looking towards the winter concerned about how their mental well-being would cope with the COVID pandemic, showing no signs of abating. You've published a winter plan for dealing with COVID and obviously trying to balance extra measures versus the societal impacts of those on people's well-being. Already, though, attention is turning to Christmas and whether people will be able to see their loved ones and gather together for possibly the most important day of the year. Should people be prepared for another Christmas disrupted by COVID, or do you hope that the protection of vaccines will mean that grandparents can be with their grandchildren on Christmas Day? And secondly, on the health disparities you've talked about today, I wanted to pick up particularly on what you said regarding the disparity in vaccine take-up between different groups, be that based on ethnicity, age, or where they live. What are some of the things that you and the government are going to do to win over the vaccine skeptics and help the vaccine hesitants? Thank you.
Yeah, thank you very much. Look, the vaccines have quite literally been a lifesaver. We over 100,000 lives saved, estimated by the ONS. I think over 140,000 hospitalizations prevented, some 25 million infections prevented. And that is why it remains what I would call like the first line of defense against this deadly virus. And that's why just this week I announced the booster program, and the first boost, actually, am I allowed to say this? Well, the first boost is happening today. It's happened today. I don't know, it's supposed to be public at 1 o'clock, so there you go. So it's gone past 1, there you go. But it's so the booster program's already started. That's over 30 million people eligible for that, and also, as you know, we announced today the extension of our vaccine offer to 12 and 15-year-olds. So that remains absolute focus. Alongside that, to complement that, what's also very important is the sort of juggernaut of a testing system that we've got. At the moment, around a quarter of the positive cases we identify on a daily basis are coming from the free testing offer, particularly those lateral flow tests. And the surveillance system we have, especially for people that are traveling back to the UK from those the tests that they're required to do, and the new treatments. That's big as well. So in terms of pharmaceutical interventions, not just the vaccines, but the treatments that we've got today that just didn't exist before. So for all those reasons, I think we've got a good level of defense. But that said, and as the government's been clear all along, that I think anyone would expect a responsible government to prepare for things if they don't go according to what we set out in our Plan A. And that's the sort of Plan B that I've referred to today, to make sure that if we need to do more, that we've already thought about that. We've talked about it with not just in Parliament, but with other businesses and others that might have to do more. And so I think we are planning as best as we can, whilst recognizing the path there's uncertainty remains. On your vaccine point about the hesitancy, it is, as I gave some examples just a moment ago about some of the disparities, especially between different community groups. And there's a huge effort going on to try and get more people to take it up. What I'm finding is that rightly, you just have to spend quite a lot of time trying to persuade people, and sometimes almost like one-on-one intervention. And that's what a lot of the public health in the people in the different regions, that's what they're doing. They actually, we obviously know who's been vaccinated, but we know where the levels are lowest in certain communities. So, for example, in some communities, we have vaccine vans that will go out, and you can go out and they literally be there for hours, encouraging people, dropping leaflets, knocking on people's doors, asking them to be vaccinated. I think that's the way to do it. And when people get vaccinated, not just for their own benefit, for the community around them, we won't stop. I will carry on. I want everyone that's eligible to take up their offer, but we will keep offering, but we have to work with people, work with communities.
Thank you.
Thank you, Saj. I'm going to go to a couple of the questions we've had online that are flying through to my phone. You wouldn't be at a CSJ event if we didn't mention the F word, the family. And you've mentioned it in your speech, and you always do, speaking wonderfully about your own upbringing and your mother in particular. What role do you see the family playing in what you want to take forward in this way, the first defence, the proper first defence of what's going on in people's homes? There's questions coming in about how can we mobilise and support the family even stronger?
Yeah, I think I could take a great example from today, actually, from our round table. And one of the representatives of a fantastic charity that supports males in particular with mental health problems, dads, uncles, sons and things. The point they made, and I thought it was a very powerful point, is that often when you find mental health problems in a family, that if you find maybe it's the father in the house or someone else, but the mother, but you work at different levels in the family, not just the people that have the problem, but try and discover what the source of that problem might be. That helps a lot. But also the work that we from the new OHID that we want to do is try and just understand a bit more how we can support families as a whole. I look back to some of the other work that I've done in government. I think about the Troubled Families program. So these would be families that have multiple challenges in their households, sometimes going back many generations. And I think that there's a fresh opportunity now to focus on those types of families and really put the effort in, but it's got to be a cross-government effort. It can't just be the local government department, it has to be my department, it has to be the education department, and having that sort of cross-government support for families is really important.
Very good, thank you. Well, the Mental lads are here, there's a name check for you. That'll be on their website later, I'm sure. On the two of those other points that have come through then, how does the new office or the changed office, the Office for Health Improvement and Disparities, how is it distinctly different from Public Health England?
Yeah, I think I was less familiar with the old setup, but from what I did see, I think the remit of public health in England was very broad, and maybe I can describe it. I tried to do a lot of good things, but it was so widespread that they couldn't really quite focus enough on any of them. And I think that, for example, in the response to the pandemic, I think everyone would agree if we look back now, we would have done things differently in terms of preparing for a potential pandemic. So what's different now is that we have taken Public Health England's responsibility, and broadly we've created the UXA, which will focus on the sort of risk of future pandemics and the sort of nationally, and work with international partners and very much focus on that. And we've created OHID, which will focus much more on, as I've described, on health disparities. So the biggest difference is focus. It will get support, it will get resources, but the people within OHID will just have one mission, and within that they will all be split into respective teams, and it will just be relentless focus. And I just don't think we had that kind of approach before.
Very good. One last question here, and then I'll go back to the floor. It came up in the roundtable, which were there quite a lot. But, and again, CSJ passionate about small community groups, about the people on the front line that are doing the kind of work day in, day out, kind of first resistance and all the rest. How will you ensure that these guys get a big slice of the pie and not just the big fellas that often take all the big commissioning money and all the rest?
I think there's lots of things we can do. If I share with you one example, at the moment, the bill in front of Parliament, the Health and Social Care Bill, what it's doing is it's taking what are referred to as the integrated community boards that cover each sort of part of the different regions of England for the health and social care support. And it is taking those, putting them on a statutory footing, but also below them creating integrated care partnerships. And in those partnerships that will oversee the delivery of those services in every region, it will include third sector organizations, community groups, large and small, and they will have a real direct say in both how resources are used locally, but also what the priorities are. I mean, that I could think of other examples. That's just one real example that's in front of Parliament right now.
Thank you. Any other questions from the floor? No, we've got a shy bunch this morning. They've had too many cakes. I'll go back to this then. If anyone wants to think, catch my eye. Final couple of questions then. Yeah, this is a good one. This came in from Claire from Coventry. It felt like you used the tricks of the trade and your treasury experience to get some added money in to cure the backlog. Money and finance always comes up. Investment. What other tricks of the trade can you use to get further monies into the areas that need it?
It's a partnership. It's a partnership in government. And It was a big decision by the government, obviously the right decision, to get the resources that we need into health and social care, especially when you look at the challenges we face as a country the last couple of years, that something different had to be done. And the Treasury normally would be very reluctant, rightly so, to create a new tax or levy, even to hypothecate a tax. But the fact that we were able to work together, myself, the Chancellor, the Prime Minister, and others, and achieve that, I think it just shows you how big a priority this is for the government, and how committed we are to not just the health and social care challenges, which are big in themselves, as we just talked about, but the whole sort of agenda for the next few years, the priority that we're going to have, which is all around levelling up and making sure that we build back better.
Fantastic. My phone's going ballistic, telling me to wrap it up because we're way over time. But I just want to say on behalf of everyone, it's not lost on us that you're first out the traps, out to communities that most need help, most need investment and belief. And we're very grateful for that today, Sajid.
Thank you very much.
Thank you.